You are listening to the INCJ podcast, Conversations about International Criminal Justice.
My name is Charlie Brooker, and I am the Professor of Mental Health and Criminal Justice at Royal Holloway, that's the University of London. And I'm here today with Coral, and I'm here today with Gerry, and they're going to introduce themselves. Coral?
Yeah, so hi, I'm Dr. Coral Sirdifield, and I'm a Senior Research Associate at the University of Lincoln.
Thank you, Coral. I'm Gerry McNally. I'm Assistant Director in the Irish Probation Service, where I look after research projects and policy developments. I'm former President of the Confederation of European Probation, and I currently member of the research group in the Confederation of European Probation. And again, I've had a long involvement with the mental health issue in probation, both in Europe and at home in Ireland.
Thanks, Gerry. Thanks, Gerry. What we're going to be looking at today very specifically, although I'm sure the discussion will lurch in a number of different directions, ostensibly we're looking at probation staff and their knowledge of or attitudes to mental illness. And this is something that's been of enormous interest for a number of years now for us. Coral and I particularly working together, we published a paper on this in 2010, looking at implementing a training program across the Trent region in England. And there's been more recent developments that we'd like to sort of talk through, really. We've only got a few slides to share with you. I mean, one of the first questions is, why is it important that probation staff know anything at all about mental illness and attitude to mental illness? And if you look at the first slide we've got here, which Rob is going to put up for us. You'll see that one of the reasons is it is so overwhelmingly prevalent, mental illness probation. And of course, the same is true and to some extent in police stations as well. And as we heard with the first presentation, across the criminal justice system. But I think it's worth reflecting on this data a little, particularly in terms of psychotic disorders. So overall, the prevalence of any current disorder is nearly 40%, which means that, you know, if you've got a caseload of 60 people, 24 of them on that caseload will have a mental illness, and half of those will have a serious mental illness. So it is quite an important topic in terms of the way it presents itself. And it's been in a lot of people's minds, mental illness. I'm going to go to Coral now because she's going to talk a little bit about the thematic review that took place in England. Coral?
Yeah, sure. So there's been some recent work, a sort of joint inspectorate thematic review around mental health across the whole of the criminal justice pathway. So that was a really big, important piece of work that we were really pleased to see happening. And basically, the inspectors were looking at the whole of the criminal justice pathway, so following people all the way from the point of arrest through, police, prisons, probation, courts, all the different stages, and also interviewing professionals working within each of those settings to kind of unpick how do we work with people with mental illness in the criminal justice system, what's working well, what isn't working so well, what are the main kind of areas for improvement, where have we got pockets of good practice, all of that kind of stuff. So it's a really, really big, impressive piece of work, really, which I would recommend for anyone to read if they're not aware of it. But some of the recommendations from that are relevant for what we're talking about today because they did focus on the need for training. And when they looked at training across the system, it was quite variable. So for prison officers, all new prison officers should receive some training around mental illness at their induction. But then the inspectors found that there was a need for kind of follow-on continuing professional development, to keep that training up to date, provide kind of refreshers for people. In terms of the police, they found that most police forces do have e-training available to them. So that was positive. And also some forces were doing some really good examples of face-to-face training. All liaison and diversion services had relevant training. But in terms of probation, I think it was kind of more of a mixed picture, in that there was training available to staff through the QUIP, but still 70% of practitioners said that they didn't have access to effective mental health learning. The report suggests that perhaps the reason for that was because the training that was available to them was seen as a bit too simplistic. And one of the kind of findings that really jumped out to me from the report was the idea that often practitioners were sharing with the inspectors the idea that they kind of regularly come into contact with people with mental health concerns that they don't necessarily feel qualified to work with. So there's kind of a clear need there really to improve training in that area, because, as Charlie's just shown through the prevalence figures, it's kind of the bread and butter, if you like, of probation practitioners' work. They will regularly have contact with people that have a mental illness, and they have a role to play there in terms of supporting people to be able to access appropriate services, and also, of course, to consider that within any sentencing recommendations as well. And Gerry, I know you've been doing some work in Ireland around this.
Yeah, I think that's the point I would follow on from what you're saying, Coral. In my experience, I've been over 40 years as a probation officer in Ireland, and I think there's no point throughout that entire period that I would say that mental health hasn't been an issue for probation officers, because it's an everyday experience for probation officers to meet people at various levels of upset and distress, and whether at the extreme level or at the more moderate level. And just to echo Charlie's findings there, our most recent study conducted in 2019 by Dr. Christina Power over a series of projects in Ireland echoes the same level of findings, that, for example, over 43% of persons on supervision in the sample in Ireland had experienced active symptoms of mental illness and mental health problems. And particularly this was an issue for female people on probation. So I think that there's a very clear perspective there, because that's over twice and almost 2.5 times the national average of 18.5%. So you can see that the people on probation are at a particularly distressed level and a particularly marginalised level. And another point that follows on from was that of that 43%, 30% were engaged with the services. But that meant that there was a big gap there, that there were people with clear mental health issues and histories, but who were not fully engaged with the services. And I think that's where you really need to look at how do we actually join up the services. And that comes back to your point, Coral, about the training and preparation for probation officers. In Ireland, and in most jurisdictions, and as had been in England and Wales many years ago, the background for social work for probation officers was merely a social work training or psychology or something similar. The issue there was that to what extent was mental health included as a core curriculum within that, and to what extent was training provided? And I think that's what Charlie's more recent studies have kind of helped to point up the questions about. But certainly mental health is a core issue for probation officers in practice. In wearing my other European hat, I think that point is shared right across Europe. And I'm sure Charlie will talk a little bit in due course about his more recent study, looking at the level of training and competence among probation officers in Europe, because I do think the incidence among people on probation is fairly standard and common, if not higher in some jurisdictions. But I think the skills and competencies is something that certainly, because we need to look at how do we cope with it, but also how do we engage with the other services to deliver the best outcomes for the people on probation.
Yeah, thanks, Gerry. I mean, it's not difficult to start to feel, in comparison to the prison service, for example, that probation is marginalised in some way in relation to this topic. And the reason I say that is if you look at the recent Council of Europe survey that was undertaken for the white paper and its recommendations, which are out to the public now, on almost every dimension, it's so much better in prison. So, for example, take training in mental health. 74% of prison officers get offered training, 37% probation staff do. 95% of countries have a policy mental health prison, and something like 25% have a policy for probation around mental health. Suicide is monitored very closely, and there are usually policies and strategies to address that in prison. In very few countries across Europe is suicide monitored, or is there some kind of suicide action plan in place? And I have to say, you know, of all the events that have most moved me, I remember when we just finished the prevalence study, Coral, and we were presenting in Lincolnshire. Do you remember this? There was a probation officer who stood up and said she was trying to deal with a suicidal woman on a Friday afternoon who was highly distressed and was crying as she gave a sort of testimony about that event, what she couldn't do, what she didn't know how to do, how helpless she felt. It stayed with me a long time, that particular scenario. And I think it's not just across Europe. I mean, if you look at the recent IACFP report, I don't know if you can see it there, that's the International Association for Correctional and Forensic Psychology. They have surveyed probation across the world, including Japan, including Singapore, including many European countries. It's a very broad sample. And 55% of the people that they sent a questionnaire to said they didn't feel mental health training was adequate. So, you know, it's a pretty poor picture, one has to say, across the world. I don't know if either of you want to come in again on that.
Yeah, just to echo that a little bit, Charlie, because I think that is similar to the findings that we had in Dr. Power's study in Ireland, because we identified three key issues. One was a fairly obvious one, that there is a significant level of unmet psychological and psychiatric needs among persons on supervision. But secondly, there's a need to strengthen the knowledge and develop the skills-based training for probation officers. So we need to help them to recognise what mental health issues are, and when identified, to identify the appropriate services that we're working with. So it's that kind of upskilling. But also, the third thing that was probably the most thing is about integrating the services. There's a need to improve and strengthen the engagement and with mainstream services. So in other words, we need to create more joined up services. This is not about creating another parallel service that works independently of each other.
No.
We have to really avoid the silos approach. And we do have to create a much more joined up service between the criminal justice system, in custody, out of custody, this mental health services, and have them all, the mental health services in the community, but have them all working together and having a kind of an open conversation and sharing of information, but mutual support for the benefit of the people. Because this is part of the need for, this is why we need probation officers to be able to recognise and address, but also to be able to link and engage and support people through the system. So that's my little contribution on that one. That's the current one. And again, as you say, Charlie, it's not in any one jurisdiction, it's across the board.
I mean, I think one of the slight problems with that in England, and from listening to the first presentation, I think it's also possibly true this in Australia and the United States and maybe in other countries. one would like, ideally, a probation officer to be able to recognise what sort of mental health problem someone has and where the best service might be to refer them to. But that is problematic for many people in the general population already because of the lack of investment in mental health services. I mean, there's a stark example in the thematic review. I don't know if you know what I'm talking about, Coral. Do you want to remind us?
No, go on, you say. I'm not sure.
Okay, well,
which one you mean?
Somebody came out of prison into probation, had a serious mental illness, and was referred to a community mental health team and told there was a 2-year wait. Remember this one?
Yeah, I do know.
And the judge recalled that person to court, sent them back to prison because he felt without treatment they weren't safe. So, is this really the way that we're organising that cooperation between mental health services and the criminal justice system? Because if we are, it strikes me as dire.
And I think some of that comes back to the kind of understanding of the needs of people on probation as well. So I know when we've looked at like joint strategic needs assessments across England and Wales, which are conducted to inform local commissioning decisions, it's not very often that the needs of people on probation are considered within those. Even though the guidance would say that they ought to be, and that criminal justice agencies should be represented on the local health and wellbeing boards, that's not always the case. And I think there's a real need to kind of evidence what health and social care needs, or, in this instance, what mental health needs people on probation have, so that can then be shared back with commissioners to kind of close that circle, because at the moment, we don't have the right services to meet people's needs, and certainly not to meet them in a timely manner. But it's a bit chicken and egg, we kind of need to gather that evidence to start with to be able to then know which services to fund. So there's a big piece of work to be done there, I think.
Yeah. But that's why I'm very envious of Ireland, because Ireland, you actually produce policy at a national level in terms of integrating services, didn't you, Gerry?
Yeah, and I think that's been the ambition of the mental health policies for many years. We have a policy going back many years now called Vision for Change, and then we have Vision for Change Updated, which is very much built on the notion of integrated services, coordinated services. The difficulty is translating that into reality on the ground, having the right resources in the right place. But I do think the particular challenge for us, and I know it happens in every other jurisdictions as well, is about bringing the criminal justice system into that mental health, because there's I'm doubtful to say, I'm cautious about saying it, but there is a certain reluctance to engage with what's described as forensic, because psychology or forensic mental health, because that's seen as more dangerous, as more threatening. Whereas in reality, I think what we would highlight and emphasize is that people on probation or people in prison are people, and in the first instance, and are entitled to and need the support of the mental health service in the same way, and present with many of the same issues and concerns. And I think it's about that idea of integrating rather than separating. And it's about that idea about ensuring access to services, because distressed people need help and they're at risk without that help, whether they're in the criminal justice system or whether they're not. And I think that applies to not just to mental health, but also to homelessness, to education, to access, to everything else. It all adds up to that great big question of marginalisation. And I do think mental health is a major factor and a major aggravating factor in marginalising and excluding people. And I think as far as possible, we as professionals, both in every jurisdiction, need to work together to try and make sure that people get the services and support they need as quickly, as efficiently as they do. But I do think as well as we need service to be inclusive rather than exclusive.
Yeah, definitely. Because at the moment, people often get bounced around between different services. And I think there's something in what you said there, Gerry, in terms of whilst we don't necessarily want, a separate set of provision for people that have been in contact with the criminal justice system, it is important to recognise that often, people on probation won't be accessing services through the sort of traditional routes for a whole host of different reasons. And actually, probation can provide a really important kind of point for making a difference in that sense, that there we've got staff that can actually help to facilitate that access for people that might struggle to access services otherwise. So, I think there's a really important role to play there in helping those people into mainstream provision.
Yeah, absolutely. Do you want to say anything more about the 2010 study that we did on training, Coral?
Yeah, can do.
Well, just for a bit more added context,
Sure. Yeah. So I think going back to 2009, the CEP held a conference. The theme of that was around the idea of having like a pan-European training curriculum for probation staff. And at that time, Charlie and I had been working with a probation practitioner called Mark Gardner on developing some mental health awareness training on a local level. And that was rolled out across the East Midlands region of the UK using like a train the trainer model. And we did an evaluation of that. So we collected kind of pre and post data from probation staff, to look at like their knowledge around mental illness, their confidence in working with people with mental illness, their attitudes towards mental illness, and their practice in terms of making referrals into services. And basically that evaluation was really positive. So we had, I think it was over 90% of the staff saying that they would be able to apply learning from the training to their daily practice. We were able to show that their knowledge had improved across all of the different kind of domains within the training. And so had their confidence in making referrals into mental health services. And we kind of concluded from that evaluation that that sort of training should really be a core part of any kind of pan-European training for probation staff, because clearly the staff had found it to be useful. It had a positive impact. It kind of normalised mental illness, and helped to kind of combat some of the sort of myths and stereotypes that there can be around mental illness. It helps them in terms of being able to recognise signs and symptoms of mental illness so that they could consider that in sentencing decisions and kind of day-to-day practice, and increase their knowledge of how to make referrals. I think, we've talked about this before, Charlie, like on reflection, we perhaps could have gone further with that, and we might do things differently were we to do it again. And ideally, I think it's complicated, isn't it, if you think about it at a European level, because different roles for different probation systems and different sets of mental health provision in different areas. But ideally, I think as part of any training, you would be making those strong links with mental health services. So, perhaps inviting them in to be part of the training, and also having some kind of lived experience stuff within there as well.
Yeah,
would be
definitely.
good. That's something we didn't do before, but I know in the research that I'm leading at the moment, that's definitely come through as a strong theme, that lived experience should be part of any mental health training for probation staff.
I think just to come in on what you're saying there, because I remember, Coral, I was one of the organisers of the 2009 event, and I think that's the importance of it. It's almost like the persistence, because it's not something you can do once and expect change to happen.
No.
It's something, this is why we're talking about it now in 2023. And we were talking about it in 2009, and we were talking about it before that as well. I think there's an importance of a degree of persistence and not giving up quite so easily. I think particularly, and you mentioned that there's the CEP event, we need there's a common thread across most jurisdictions. most jurisdictions are slightly different and different perspectives, but there's a common thread that there is a problem and there is a challenge and there is a mental health issue. And I think that's where organizations like CEP particularly come into play, because as the Confederation of European Probation, we actually act as a network. We encourage jurisdictions to talk to each other, to share expertise, to share knowledge and share learning. And I think that's where we get that common thread to actually pull the agenda along. And I do think that there is a shared agenda. And I think, Charlie, your more recent research, which was commissioned by CEP, is an example of that, because in 2017, 18, 19, CEP developed a research perspective, because, as you mentioned earlier, we need to gather data, we need to know what the issues are. And one of the very first topic that we chose to follow up on developing a research agenda and actually funding research was to do this European mental health study on competencies and skills among probation staff and addressing. And this is about bringing the ideas together on a European perspective, because everybody can get the information and then apply it in their own jurisdiction in the best way possible. But it's about creating that agenda. And I think that's why we need not just the local agenda, but we do need that wider cross-jurisdictional function. And I think, Charlie, you could say something more about that study, because I know we worked together in getting it off the ground, and
we did
hard work thereafter, both with CEP and with the Council of Europe, because again, Council of Europe doing a study on mental health in probation and prisons, CEP was able to go in and lobby for that kind of subject to be brought up. And again, it's about putting it on the agenda and driving the agenda as far as possible.
Yeah. Thank you very much for that beautiful segue, Gerry. Absolutely brilliantly done.
Passing ball.
So we undertook a survey of practitioners working across Europe in all the jurisdictions, and that's possibly as many as 40, 50. And we gave them to fill in electronically a questionnaire called the Mental Health Literacy Scale, which was developed in Australia and which had recently been included in a systematic review of knowledge and attitude scales to mental illness. And these are the scores that we found. The top one is the knowledge of probation staff across Europe, and the mean was 128. In the validation study, O'Connor and Casey found that if you were a mental health professional, you were likely to score 149. I think the top score was about 156. The general population in Portugal scored marginally more than our probation staff. Christian clergy in the United States did. And this is just a whole series of other studies for the purposes of comparison. And police academy students in the States scored 106. I could just hold the second slide for a moment. We got a really good response to this survey. We had over, I think, 500 responses. We can go back to the response rate, actually. Thank you. Next slide. And what this slide shows you is the response rate by country with that's the columns. The columns are the score on the mental health literacy scale, and the round circles are the number of responses we got from each country. There's some interesting findings here. For example, the highest score of all the probation services across Europe was Northern Ireland. Now, Northern Ireland is a very particular case of a probation service. They employ something like 18 forensic psychologists working alongside probation, the kind of co-response that our Australian colleagues were talking about earlier. And that's a sort of 1 per 100,000. ratio for the number of forensic psychologists for the general population. If you turn to England didn't participate in this study, but if you turn to England, we have something like one forensic psychologist for 14 million of the probation for the general population, and that is extraordinarily higher ratio. So what this shows to me here is that, and Malta to some extent also employs quite a few in-house forensic psychologists and had a high score. What this shows to me is that, there's something about the way that probation services are organised and their access to expertise that's really important in terms of the knowledge of mental illness that probation staff have. And nowhere is that more starkly exemplified than in Northern Ireland. I mean, Gerry's, I'm sure, very proud that Ireland are so high there in comparison to all the other countries. And some countries got some really low scores, I mean, at the bottom end of the spectrum, Moldova, Estonia, Turkey, Albania, you're looking at 110, you're closer to the American Police Academy students than you are anybody trying to provide a sort of public service. But this was, I think, an important finding. Gerry, do you want to comment on it?
Yeah, and I just, what I would particularly comment on is that while the average is at a particular level, I think there's a huge amount of room to improve.
Yeah.
Because you would hope that probation officers would have a little bit more competence and confidence in working with these teams because of the prevalence issue, because of the level of mental health issues. You would expect and you would hope that there was maybe a higher level of expertise. And I think that's the challenge to us, to actually improve that level of knowledge.
I think your use of the word confidence is interesting there, because as you know, we found that the higher your knowledge score, the more confident you were in working with people with mental illness. And surely that's what we want. We want people to be confident in their dealings with people with a mental illness and helping them to the best of their ability. I think the other issue that we haven't kind of dwelt on at all in relation to is that very few probation services actually define what they think the role should be for the probation officer. You alluded to one earlier, Gerry, and the one you alluded to was very much the one enshrined in the health strategy for the English probation, which is basically twofold. It's to recognise that a disorder exists, and it's secondly to know where to refer that person to the best service. But that assumes quite a lot, doesn't it? It assumes that you have the knowledge to do the recognition. It assumes also that you've spent some time working out, finding out where the local network of services are, what their referral criteria are. How do you know whether you've reached the criterion or not? Well, Coral and I published a paper earlier in the year where we suggested some measures that could be used when screening clients at assessment to understand where those cut-off points might be. And there should be a conversation with local services about when certain cut-offs are reached, which particular service people are referred to. Do you want to say anything about that, Coral?
Yeah, I mean, I think the problem at the moment is kind of the complexity of commissioning and provision, really. And, as someone working for probation, how you navigate your way through that complexity. And I think in an ideal world, you would have a very clear pathway, where you could say, okay, we've assessed somebody using this tool and they've scored at this level. And, we know X, Y, and Z about this person's needs. And as a result of that, this is the pathway that they should take. This is the form I need to complete or the process I need to follow to make a referral to service X. And in a different scenario, You follow that pathway through, and it leads you to service Y.
Yeah.
And then you've got the ability to assess the need, make an appropriate referral, and the referral goes to the right place. But at the moment, that doesn't always happen for a host of different reasons, and I think there's a lot of work to be done to try to establish those pathways, and there are different pieces of work being done to establish those pathways, but we kind of need them to be simple and straightforward to use, and like Gerry said earlier, for it to be a kind of open door policy, really, rather than a really complicated set of different boxes that you have to tick to be able to access the service. And even the difference at the moment between, have you been to prison before you go on to probation, or have you just, been given a community order, can make a difference to how you access services. And, it's the complex picture that we need to try to simplify it and give staff kind of the knowledge and the tools that they need to be able to make those connections.
I'm just looking at the time. We've got about 5 minutes left. What I'd quite like to do is to get a concluding view from each of you about what you'd like to see happen. I'm going to go first. As you both know, I'm very taken by the role of the specialist probation officer in the United States and the way that intensive training in mental health is given to a subgroup of a probation service. They pick up the heavy load, as it were, of people with a serious mental illness. In doing so, they have smaller caseloads. As I say, they've got intensive training. In some services, they act as case managers. They hold a budget for accommodation and other things. I'm very taken with it. I'm very pleased to see at 4 o'clock I'll get a chance to learn more about it with the folk from Georgia. But I think the other thing about the role of the specialist probation officer is that if you look at the States, there's a lot more reports of different training programs in mental health that have been going on, and we're accumulating those in the CEP Expert group. We're going to try and come up with a composite suggestion in that group about what the core European mental health training modules should look like. I mean, they've got to cover some very obvious basics, haven't they? What is serious mental illness? What medication are people likely to be who've got a serious mental illness? What are the other mental health disorders? What do you do in a crisis? There's some very obvious headings, I think, for modules that we need to develop in terms of the content. The other thing that's interesting is that the states actually evaluate their training programs. And like Gerry said earlier, knowledge per se is not enough. Psychology has a concept of functional knowledge. That is knowledge that changes behaviour, is not just assumed. And we should be pursuing functional knowledge for probation staff. It means they do different things. So over to you, Sue.
Can I go next?
Yeah, you go next.
Okay. So for me, I think it's coming back to what I said earlier in terms of we need to evidence the need so that we then know what sorts of services to commission and provide. I think it's also about understanding what really good quality mental health care for people on probation looks like. So what standards do we need to meet? And then trying to evidence whether we're meeting those standards or not. And within that, then giving probation practitioners the knowledge and the skills that they need to be able to play their part in meeting those standards, so to be able to recognise the needs that people have and make those referrals and provide support to people, so that they can comply with their probation order, and have a chance, if you like, of rehabilitation and not being recalled into prison, really. That would be my take. And I think, mental health awareness training is a core part of that.
Gerry, would you like to sum up all 40 minutes and then we'll call it a day?
You want me to talk for 40 minutes? So that's not a
No,
problem.
not another 40 minutes.
No, I just to highlight, I think there's a few things that have come up during the discussion there, and I was taken particularly when you were talking there about the competency and the confidence. I'm always I'm always anxious to raise people's competence so that they have the confidence to do what they're doing. I think it's good to have competent people who are confident in doing what they're doing. I'm much more cautious about having people who are confident without the competence. And I think it's that partnership and that joining up ways, because it's not just about knowing what the pathways are, because I think it's important to be aware and have not just, as you say, the functional knowledge, but the functional common sense to be able to keep it going, because it's not a question of referring people and then standing back.
No.
There has to be an ongoing support and a partnership, not just a partnership with the other services, because I think that's very important in their mutual support, but a partnership with the person on supervision to work with them, because it's not doing things to people, it's doing things with people.
Yeah, absolutely.
And I think it's so you're looking at competency, confidence, pathways, partnerships, and you're talking about flexibility in being able to respond to whatever is needed, because sometimes it requires radical action. Sometimes it doesn't. Sometimes it means having the kind word at the right time. So it's about that kind of a broad range of knowledge, because I don't think we're trying, and I appreciate what you're saying, Charlie, about having specialist officers, but I don't think we're trying to make every probation officer into a mental health expert.
No.
What we're trying to do is to give people sufficient understanding and competence to be able to access the services. Yeah. And I think the one thing I would say is this is part of what we would perceive as the role of CEP as the network of probation organisations. Because just as we were talking in 2009, as Coral was saying, and we're talking again in 2023 about mental health, somebody has to keep the agenda warm. Somebody has to keep the topic on thing and to keep it moving. Because unless we've got a very open mind, a challenging mind, and an evolving mind. That's why bodies like the Council of Europe become involved, because it's important to everybody. And again, I think I'm very much looking at this on this national and a European perspective, but also you can translate it back to the local, because you go back to what we're saying is how do you meet those needs? How do you create those needs? But how do you work together? So really, I think mental health is a core part of the work of the probation service. It's the core part of anybody working with people on the margins. But also, it's also a core challenge to us in how we can actually support each other in doing that. So I think it's about probation officers not just talking to other professionals, talking to the psychologists, but they need to be talking to other probation officers and to the prison services and to the community services.
And to people on probation as well, to get their perspective on what works for them and what choices they would like.
Yeah, and I think that's a very important point, because that's why I'm saying it's about not doing things to people. Yeah. Because it's about the lived experience. The people who've walked the hard yards know it best, and they can help us to work to make that better for everybody. So again, there's a whole agenda there in that as well. So there's a lot, I think, as we frequently say in Ireland, a lot done, but a lot more to do. And I think that's I think we're on a journey. We're making progress. It may be slow, it may be frustrating, but I do think the important thing we can do with it is what I started off with, is about persistence. We have to be dogged, and we have to be persistent, and we have to be able to think that we can make things a little bit better with the people, for the people, and for ourselves as well.
Oh, so thank you both very much. I really enjoyed that discussion. I hope that the international audience has as well. Back to you, Rob.
You have been listening to the INCJ podcast. Conversations about international criminal justice. To find out more, go to our website at criminaljusticenetwork.net or follow us on Twitter at INTCJ Network.